Speaking Monday at the annual meeting of the World Health Assembly, Director General Dr. Tedros Ghebreyesus defended the World Health Organization, saying the world does not need new organizations. It needs to make the ones it has work better. He warned against letting short-term amnesia erase the lessons of past pandemics and that a comprehensive framework was needed to raise responsiveness. He also cautioned that the low levels of antibodies detected so far show herd immunity is still a distant dream. With infections still rising, what now? Do we back the World Health Organization, reform it, as critics demand, or create new organizations dedicated to pandemics? How do we prevent future outbreaks, and where is help needed the most? In our first segment today, I'll talk to Zhao Hai, a research fellow with the Chinese Academy of Social Sciences. Mr. Zhao, thank you so much for joining us. Now, I would like to start by quoting Dr. Tedros, who said on Monday on the World Health Assembly that the world doesn't need another plan, another system, another mechanism, another committee or another organization. He said it needs to strengthen, implement and finance the systems and organizations it has, including the WHO. Do you agree with this assessment, or do you think that we really need to create a new international body or bodies or mechanism just to deal with epidemics, or create a global fund expressly for this issue?
Well, I totally agree with Dr. Tedros on this issue. I think there are no other multilateral organization that can replace the WHO. The WHO is directly under the United Nations, is part of the United Nations system, and is part of the global communities, the whole family of global community. So all the countries are part of the WHO, and WHO should execute its responsibility fully and with the support of all the member states. At this point, I think to replace WTO or to suggest that WTO is no longer functioning is totally wrong. And I think we should focus on how to support the WHO and give its full funding for it to work properly. And at this point, I think any weakening of the WHO is self-serving and is self-destructing. And if we only focus on politicizing WHO and its functions, not letting the experts in science to work things out, it's very distracting, and it's not saving lives. It's waste of time and totally waste of resources. So at this point, I think we should listen to Dr. Tedros and support the organization to finish its job of containing the COVID-19.
Well, I think for any international scientific organization, you can never have the absolute correct answer to everything at any moment from the very beginning. So how do you look at the kind of guidance that the WHO has been able to give to the world from the very beginning? There are steps which people have reasonable doubt whether their announcement, for instance, some of their Twitter information might have been most accurate, and yet does that give rise to the kind of absolute necessity to replace this organization with another one, or to threaten to cut funding to this organization, or throw it away, throw the baby away with the bathwater?
I think you're right, because no organization, no process, no mechanism is perfect. There are problems within the system, how to respond to reality and how to respond to, for instance, this particular coronavirus. There's no one guidance. There's multiple guidance, and the guidance has been constantly updated because new data is emerging. And if you look back at SARS that happened in 2003, after SARS, actually people come back and experts re-examine the whole process, updated the system, and by 2005, and then 2007, we now have the international health regulation. The same thing should happen to this time COVID-19. We learn from what happened, the shortcomings, the mistakes, and then after the ending of the controlling of the coronavirus, we can come back and update the current regulation and make the future process and response more timely and more correct. I think that's the right process.
Do you also think that people understand absolutely how the WHO works, because this is not a supranational organization which has power over member states. Actually, it's a member state-driven organization. Like many international organizations, it is driven by member states. Everything has to be built on consensus of member states and their willingness to do, to be driven. So how do you look at the kind of limitations also of these kind of international organizations? And then if domestically any country failed to meet up the challenge of certain public health crises, should an international organization that is member state driven be held totally accountable?
I think for international organizations like WHO, what needed most is mutual trust, cooperation, coordination, and fundamentally individual states' responsibility. I think in many cases, if you look at WHO and how it functioned, it acted like an information hub. You need transparency, you need timely response, and timely contribution of data so that WHO can make its guidance and distribute to other states to prevent certain disease. That's how it works. It's not like WHO is directing each country and ordering them to do this and that. So ultimately, as you said, it's built on consensus, and all the states should respond to their own domestic situation individually. People can learn from WHO's data and lessons, and can learn from the guidance and make their own domestic guidance. That's how the system works, and I think that's how we should support WHO in that matter.
Well, the United States, especially under the under this administration, has been calling for the WHO to be reformed. Otherwise, they're going to cut funding, and this time they threaten to freeze funding permanently. So do we have any idea what kind of organization they're talking about, and what do they mean by reform? To give more power to, I don't know. Do you have any idea? Is there any clarification as to what kind of details of this reform that the U.S. president is talking about?
Well, you have to constantly pursue President Trump or other, White House officials for clarification, because every time they say something, it's so vague and there's no content of it. It's very hard to understand exactly what they're demanding. But from the letter that Trump put on the Twitter account, and also from other State Department official statements, you can learn that actually the U.S. want more control of the WHO. They believe that somehow WHO is under the direction of China, and it's only praising or listening to China, not listening to the U.S. So at this point, I think at every juncture, the United States and President Trump himself in particular, seeing this COVID-19 as some sort of a competition of systems between the United States and China, between the United States and the rest of the world. And if U.S. is not doing well, it's because of the WHO. That's how they want to reform. They wanted to show, actually they want to make themselves look good instead of making WHO function more properly.
All right, I have to interrupt you there. Yeah, I have to interrupt you there, Zhao Hai, because we are joined on the line in our segment called Listen to the Scientists. I think it is high time that we do that. I'm going to talk to epidemiologist, infectious disease specialist, and dean of the Yale School of Public Health, Dr. Sten Vermund, who's joining us from the United States. So, Dr. Vermund, thank you so much for joining us. I want to ask you about your comment on Dr. Tedros' statement about the world doesn't need another plan, another system, or another committee, or another organization, but rather to strengthen, implement, and finance the systems and organizations it has, including the World Health Organization. From a public health scholar and medical doctor's perspective, what is your viewpoint?
For many years, for 4 decades, I've worked in Asia and Africa and Latin America in global health. WHO is the one organization in the world that has representation in each and every capital city, that has a partnership with each and every Ministry of Health. And the WHO creates a bond between countries that is multilateral, that is not addressing the needs simply of a single country, not of the United States, not of Germany, not of China, but of all the countries in a common goal. And its primary purpose has been global disease control and prevention, and also has been capacity building for the countries that are not wealthy, don't have the resources of the high and middle income countries. And I believe that in this capacity, WHO is quite essential.
Now, everybody agrees that international cooperation is key to containing the COVID-19. However, we face this crisis at a time when the international bodies capable of doing so, such as the World Health Organization, are underfunded and even under attack. If this situation persists, how will it affect the global fight against the disease? And how can we convince the world that it is in everybody's interest to fight with each other, alongside each other, and not alone, and especially not against each other?
Our current leadership in the United States, in the White House, has some very strange views of the world. In the middle of a global pandemic, the action is to cut funding to the international agency in the best position to help nurture the response, the global multi-country response to that pandemic. So it's not reflecting, I think, the views of most Americans. I believe that most of us think this is the time to bind together as an international community. The virus respects no boundaries. It cares nothing about people's political viewpoints, and it cares nothing about global trade interests. All it does is spread person to person, and we need strong evidence-based disease control strategies. It's not the time to disrupt the global response with vague demands for reform and threats of cutting funds. So I can't explain the mentality in the White House other than to say that they would like to scapegoat someone for their own failings.
Dr. Tedros also talked about the willingness to initiate an independent evaluation at the earliest appropriate moment to review experience gained and lessons learned, and to make recommendations to improve national and global pandemic preparedness and response. From your understanding, Dr. Vermund, what are some of the lessons maybe that we have learned in this collective fight against this virus, and how do you look at the function, the effectiveness of such an international and professional review carried out within the framework of the World Health Organization?
We are always trying to improve our global disease control strategies, and it is very wise to learn from lessons in a crisis like this. So one already has some early insights. China, I think, made a big mistake in the month of December by taking a sort of denialist view in Wuhan, and that permitted considerably more spread than would have occurred if there had been the prompt attention to the whistleblowers who were saying, wait a minute, we've got a problem. If higher officials had taken that seriously, we would have had a more rapid response. Similarly, in the months of January and February, if the United States leadership had taken the obvious global pandemic threat more seriously, perhaps the United States would not have become the global epicenter for the pandemic. So the two wealthiest countries of the world, from the point of view of the size of their economies, the United States and China, I think we will have a lot of both positive and negative examples there. China, when it did take the threat seriously in January, did something quite unprecedented. We've never seen a city of 11 million people locked down the way Wuhan was locked down. And currently, the circumstances in that city are highly favorable. So you'll find from places like China negative and positive examples, and similarly in the U.S., you'll find early negative examples and then subsequent positive responses where mask use did become highly prevalent. Stay in residence guidance became adhered to, and we did see the peak and decline of the epidemic in the most heavily afflicted parts of the country. So there will be positive and negative examples from all of these countries. How did the South Koreans handle this? How did the Iranians handle this? What about the British and the Spaniards and the Italians? And then some of the countries that could have had much worse epidemics but seem to have stemmed them, there will be lessons learned there. I know a lot of us are looking at the example of Denmark and Norway on one hand and Sweden on the other, which took very different approaches. We also have to think of the developing countries. Are there any lower income countries that have had considerable success? What was the story in India with the 2-week lockdown? What is the success? And this is history being made as we speak.
Yeah. Okay. Well, I'm going to ask you one last question before I bring in the other guest for his reaction and before we go into a break. But I do want to ask you about this attitude about, or the question about attitude towards science. Again, being said at the World Health Assembly, Dr. Tedros said the world does not lack the tools, the science or the resources to make it safer from pandemics. He told the conference, he says, what is lacked is the sustained commitment to use the tools, the science and the resources it has. That must change, and it must change today. So, Dr. Vermund, do you see signs of growing social and political resistance to scientific advice, and does that worry you?
We do see science skepticism. The majority of Americans believe, for example, that global warming is a phenomenon of importance and that human activity is contributing to it. At the same time, a majority of our senators do not see it that way. So there's a disconnect between the view of the average citizen and the view of some of our political leaders and policymakers. We see the same rift between science, which overwhelmingly recognizes the value of vaccines, and a growing, I'm sorry to say, proportion of our population that somehow sees vaccines as unhealthy. So we are needing much better tools for science and health communication from the experts to lay audiences and to policymakers. So we're going to have to figure out precisely why science is being received with so much skepticism and what we can do to increase communication between scientists, lay audiences, and policymakers.
Yeah.
So this is a high priority. We need to bridge people who are experts at communication with people who are experts at science and scientific knowledge generation.
Okay, finally, I do want to hear your response on this question, which is a little bit political, but I do want to hear your take on that. Basically, in a resolution named COVID-19 Response that's proposed by about 140 countries, including China, the resolution called on countries to continue to work with relevant international organizations to identify the zoonotic source of the virus and the route of introduction to human population, including through efforts such as scientific and collaborative field missions, which will enable targeted interventions and a research agenda to reduce the risk of similar events, as well as to provide guidance in the future. How do you look at such efforts? And again, noting that the United States did not join other countries in making this proposal, but the resolution is adopted unanimously by 194 member states of the WHO.
Well, even if the United States didn't participate in its drafting, I'm glad that they voted for it. That's good news. To me, it's an obvious priority to consider the threat of zoonotic diseases. When I was a little boy growing up in the 1950s, there were 2.4 billion people on the planet Earth. Today, there are 7.7 billion people. And this puts tremendous pressures on the natural parts of the world. There are rainforests, our grasslands. We have the phenomenon of desertification, the expansion of the world's deserts. This pushes people out of habitable areas and pushes them closer and closer to other areas, which become crowded and overfished and overgrazed and overfarmed. So we can expect greater and greater human contact with the animal world in a way that may be unprecedented. We also don't know what's going to happen with climate change, where fishing zones become fishing deserts in the oceans.
Okay.
And I believe that these are all linked issues: zoonotic disease emergence, population pressures, loss of species diversity, and the emergence of zoonotic diseases.
Okay. Well, thank you so much, Dr. Sten Vermund, epidemiologist, infectious disease specialist, and dean of the Yale School of Public Health. We'll take a short break, and when we return, as China takes on greater responsibilities in the international response to the COVID-19 pandemic, the U.S. is threatening to withdraw. What's happening? We'll talk about it.